Eye floaters are shapes or dots that you may notice when you're looking at a clear sky, a blank piece of paper, or a white wall. The medical name for these shapes or dots is myodesopsias. You might also notice flashes of light at the same time. The flashes of light also have a medical name, photopsias. You can experience floaters and flashes together or on their own. Both floaters and flashes happen when the vitreous or vitreous humor lifts up from the surface and pulls on the retina, creating tension. The vitreous is a gel-like substance in the middle of your eye. This process is called posterior vitreous detachment. It's a normal process of aging. These solidified pieces of the vitreous are the eye floaters that move around in the vitreous. Eye floaters are almost like little bits of dust stuck on a camera lens. You try to blink them away, but they are still there. When you look somewhere else, these shapes move with you. As floaters move, they pass in front of your macula, the center of the retina, which allows you to see their shadows. The retina is the part of your eye that is responsible for reacting to light and for passing these signals to your brain. The signals become the images you see. What do eye floaters look like? There are many ways to describe eye floaters. Some people see spiders, amoebas, or clouds. Your own creativity guides how you think a floater looks. Your description of floaters might sound completely different from someone else's definition. If you have floaters, you might see squiggly lines, spots, spider-like shapes, thread-like strands, small shadowy shapes, black or very dark. Are eye floaters normal? In most cases, eye floaters are a normal and common part of the aging process. As you get older, the fluid within your eyes shrinks. This is normal and doesn't mean that your eyes aren't healthy. It's important to maintain regular eye exams over time. Buzzards. The most common cause of eye floaters is age. For many people, floaters are a part of the natural aging process. They can be annoying at first, but you'll notice them less after some time. You might think they've gone away, but that's not true. Floaters are permanent and stay in your eye. Sometimes they can be a sign of a more serious eye condition called retinal tears and retinal detachment. In this condition, the shrinking and pulling away of the vitreous causes a break in the retina that results in retinal detachment. This can cause serious vision problems. Other less common causes of eye floaters are having blood in your eye, often linked to diabetes-related retinopathy, experiencing inflammation in your eye including uveitis, tumors. Risk factors. Risk factors for developing eye floaters are being older, having a family history of retinal tears and detachment, being nearsighted, having a history of uveitis. Treatment. The most common treatment for eye floaters is observation and no treatment, even though they can be annoying and bothersome. Eye floaters are usually harmless. They usually drift out of your line of sight, and you stop noticing them over time. This can be frustrating for people who notice the eye floaters dancing across their view often, but it's the safest option in most cases. Surgical treatment. There's a surgical option for removing floaters called a vitrectomy. Your provider may suggest it in case you have many floaters that are affecting your vision. This procedure removes the vitreous, and over time, the eye replaces it with a similar type of solution. Vitrectomy risks include developing retinal detachment, developing retinal tears, not getting all the floaters out of your eye, developing cataracts. Prevention. You can't prevent eye floaters that are due to age, but you may be able to reduce your risk of floaters by managing chronic illnesses like diabetes and high blood pressure.